Parents, did you know that children experience emotional overwhelm up to 5 times more intensely than adults? Imagine what it must feel like to have all those big emotions and no idea how to handle them. Now, as a parent, how do you tell the difference between a child throwing a tantrum and one who's completely overwhelmed by their feelings? Stick around because in today's video, we're diving into what's really going on during those emotional moments and how you can respond in a way that builds connection and teaches lifelong skills. If you're visiting for the first time, I'm Dr. Taniesha Burke, your positive parenting coach, and welcome to our channel. Before we move on, are you a subscriber? If you're not, we encourage you to subscribe because when you subscribe, you're joining a growing community from around the world. And secondly, you help to push our video into the algorithm so that other parents around the world can get access to this content. So thank you so much for supporting us. Parenting comes with its fair share of challenges, and few situations are as universally recognized as a child's meltdown. Whether it's a loud tantrum in a grocery store or an emotional outburst at bedtime, these moments can leave parents feeling absolutely overwhelmed. However, not all emotional outbursts are the same. Understanding the differences and similarities between tantrums and meltdowns is essential for responding effectively and compassionately. So let's begin by looking at the differences. First up is, what are tantrums? Tantrums are emotional outbursts typically characterized by crying, screaming, and physical actions like kicking or throwing oneself on the floor. They are most common in toddlers and preschoolers ages 1 to 6 who are still developing their emotional regulation skills. Tantrums often arise from frustration when a child's desires are unmet or when they struggle to communicate their needs effectively. So you have the definition of a tantrum, but for many parents that is not sufficient. You want more details so that you are better equipped to identify tantrums in your children. So now let's look at some of the characteristics. So, tantrums are goal-oriented. Children often throw tantrums to achieve a specific goal, such as obtaining a toy or avoiding an unwanted task. The second characteristic is conscious control. During a tantrum, children retain some awareness of their surroundings and may stop if they realize their behavior is ineffective or if they receive what they want. Third characteristic is emotional regulation. Once a child's needs is addressed, tantrums can quickly subside, indicating they are more about frustration than the inability to cope. Now let's turn to meltdown. Meltdowns are intense reactions often triggered by overwhelming sensory input or emotional distress. Unlike tantrums, meltdowns are not goal-oriented. They occur when a child is unable to cope with stressors, leading to an emotional overflow that can manifest in severe distress. Meltdowns can happen at any age and are particularly common in children with sensory processing issues or autism. So now, similar to tantrums, we're now going to go into a more detailed breakdown of what meltdowns are so that you can easily detect them in your children. The first characteristic is overwhelming sensory input. Meltdowns often result from excessive stimuli such as loud noise, bright lights, or crowded environments. The second characteristic is a loss of control. During a meltdown, children may not be aware of their surroundings and exhibit behaviors that seem uncontrollable. The third characteristic is duration and intensity. Meltdowns can last longer than tantrums, sometimes up to an hour, and may require more time for the child to return to a state of calm. So, despite their differences, tantrums and meltdowns share some common features, and now we're going to take a look at what those are. The first is emotional expression. Both behaviors involve intense emotions and can be distressing for both child and parent. The second is developmental normalcy. both are considered normal parts of child development as children learn to navigate their emotions. The third is a need for support. In both cases, children benefit from parental support in understanding and managing their feelings. Fourth is external triggers. Both may be set off by specific situations such as unmet needs, transitions, or sensory input. And fifth relates to how you respond. How parents respond can significantly impact how quickly the child calms down and learns from the experience. And in the second half of the video, we'll give you tips and tools that you can use to support your child, whether or not they're going through a tantrum or a meltdown. We have covered a lot looking at the similarities and the differences between tantrums and meltdowns. Now, what you're seeing on your screen is a wonderful table that you can take a screenshot of. So whenever your child is feeling overwhelmed, you can quickly look at it to see whether or not they're experiencing a tantrum or a meltdown. So let's quickly review. Intent, tantrums, goal-oriented, while meltdowns are emotion-driven. No manipulation will be found. As it relates to control, tantrums are somewhat under a child's control, while meltdowns are completely overwhelming for the child. The resolution, tantrums, they tend to stop when a goal is achieved, while meltdowns require external regulation to calm down. And as it relates to triggers, tantrums can sometimes be situational frustrations, while meltdowns are overwhelming emotional or sensory input. So look at this table, study it, try to memorize it. If you're unable to, take a photo of it and keep it on your phone so that you can also refer to it whenever possible. We're now then going to go to the second half, where we're going to be providing you with the tips and tools on how you can respond to a tantrum and a meltdown. A quick notice before we move on to the solutions in handling tantrums and meltdowns. As you look at your screen, you're looking at our parenting journal. This journal helps you to understand the stresses in your relationship, what you enjoy about parenting, and the goals that you want to achieve as a parent. So if you're a parent experiencing whether tantrums or meltdowns or even both, this journal is perfect for you because the guided scripts that are repeated every day will help you to track any patterns that need to be changed and also helps you to see improvements over time. So you can get this journal on any Amazon platform of your choice. Understanding how to respond to both tantrums and meltdown is essential for fostering emotional resilience in our children, and we're now going to teach you how to do that. What we're going to do right now is that we are going to break down some strategies for each situation. So you're going to get strategies for tantrums and strategies for meltdowns. We're going to begin with strategies on how to respond to tantrums. So I hope you have your pen and paper ready so that you can make some notes. So next time your child is having a tantrum, you know exactly what you need to do. Our first strategy for handling a tantrum, it's important that you stay calm and neutral. Avoid giving into the tantrum demands and make sure that you stay calm and composed. If you have to take deep breaths and take yourself away from the situation for a minute, you are free to do so. Anything that you need to do to remain composed. The main reason it's important for you to remain calm and neutral is that reacting emotionally can actually escalate the situation. Our second tip for handling a tantrum is that it's important to acknowledge your child's feelings. Validate their emotions by acknowledging their frustrations. So, for example, you might say, I see you're really upset because you want that toy. Or, I see that you're really upset because you want to watch more cartoon and it's now bedtime. Our third tip is to set clear boundaries While it's important to validate your children's feelings, it's also crucial to set limits on behaviors. So it's important, parents, that you, even though you validate your child's feelings, you need to explain to them why certain behaviors are inappropriate. Our fourth tip is to teach coping strategies. Encourage your child to use calming techniques such as deep breathing or counting to 10 when they feel frustrated. And you do this, parents, when children are calm, not when they're upset. So take some time to teach when everyone is connected and feeling wonderful with each other. Use books, use emotion charts, or you can use videos that you might find on YouTube to help them to learn these coping strategies. And the fifth tip for handling tantrums is to redirect attention. Offer alternatives or distractions that can help shift your child's focus away from the source of frustration, and this is a wonderful tip for toddlers. Our final tip for handling tantrums is to offer choices. So it's important to give your child a sense of control with options. So you might say, would you like to walk or to sit in the cart? Or would you like to eat an apple or a banana? Giving them a sense of autonomy makes them feel that they have some level of control regarding what is happening to them and within their environment. When you have a sense of autonomy and agency, you're less likely to want to push the buttons or go into a power struggle as a child. So we've just covered tantrums, and so we're going to turn our focus now and look at how we respond to meltdowns, because it's a bit different based on what is happening within our children's bodies. Our first tip is to create a safe space. Establish a cool-down corner where your child can retreat when feeling overwhelmed. And parents, it's important to create this cool-down corner when your child is calm and connected. It's not something to be done in the spur of the moment when a child is having a meltdown. So your cool down corner can be somewhere favorite in their home, in their bedroom, in the living room, or wherever space is available. You can have their favorite books, their favorite toys, music, blankets, anything that helps them to feel safe and connected. Our second tip is to reduce sensory input. If you notice signs of impending dysregulation, help your child by minimizing sensory stimuli. Example, moving away from loud environments, turning down the music, moving away from all the distracting toys, for example, that they might have in their environment, or if they're around people, taking them to a quiet spot where they are alone or with a limited number of people. Our third tip for handling meltdowns is to stay calm yourself. Parents, I know this is absolutely difficult, but it's so important. Model emotional regulation by maintaining your composure during your child's meltdown. Your soothing presence can be very comforting for your child. Our fourth tip is to use simple language. During a meltdown, avoid lengthy explanations. Instead, use simple phrases like, "You are safe," or "let's breathe together," to help keep them grounded. Our fifth tip is to use co-regulation techniques. Deep breathing is a good one, so encourage them to take slow, deeper breaths. Practice grounding exercises, so engage their senses with questions like, what do you see? What do you hear? And importantly, parents, it's important that you practice patience. Meltdowns or dysregulation often requires time to pass, and it's important that you avoid rushing your child to calm down, because this might just very well make the situation worse. While tantrums and meltdowns are typical in child development, recurring intense episodes might signal underlying challenges such as developmental delays or disorders, anxiety, or sensory processing issues. Consult a pediatrician or a child psychologist if your child's behavior significantly impacts daily life, if tantrums or meltdowns persist beyond the expected developmental stage, or if you feel unsafe in how to handle frequent outbursts. So now let's turn our attention to some long-term strategies to support emotional growth in your child, because the end result is that you want your child to be able to control their emotions on their own. The first is to teach emotional literacy. Help your child label their feelings with phrases like, "You seem frustrated," "You seem angry," "You seem tired," so that they can begin to label the emotions that they're experiencing on their own. Also, it's important to model healthy coping skills. Show how you manage emotions by narrating your strategies. Example, "I'm feeling so stressed, so I'm going to take some deep breaths until I feel better." It's also important to foster predictability. Create consistent routines to minimize frustration and overstimulation. Remember, parents, children thrive when there is predictability. As a parent, it's important to teach problem-solving skills, so encourage older children to brainstorm solutions when conflicts arise. This will help them with their critical thinking and also make them feel empowered with the ability to control their emotions. Finally, encourage mindfulness. Teach age-appropriate mindfulness exercises such as belly breathing or gratitude journals or gratitude jars. Understanding the differences between tantrums and meltdowns helps you respond with empathy and effectiveness. While tantrums require clear boundaries and consistency, meltdowns call for co-regulation and emotional validation. Both are opportunities for you to guide your children in developing self-control and emotional resilience. With patience and the right tools, these challenging moments can become building blocks for stronger parent-child relationships and healthier emotional development. We are now at the end of our video in looking at the differences and similarities between tantrums and meltdowns. We hope that you found this information informative. Now, we'd love to hear from you, so please leave your feedback and comments in the comment section. If you have friends or family who you think may benefit from this content, please share it with them. Thank you so much for joining us, and goodbye for now.